is due to mutation in A. Potassium voltage gated channel gene KCNA1, B. PKD1 gene, C. Anti-apoptosis gene HAX1, D. GJB2 gene. Costman syndrome is due to mutation in A. Potassium voltage gated channel gene KCNA1, B. PKD1 gene, C. Anti-apoptosis gene HAX1, D. GJB2 gene. What is the correct answer here? The correct answer here is anti-apoptosis gene HAX1. So Costman syndrome is due to mutation in anti-apoptosis gene HAX1. Costman syndrome is due to mutation in anti-apoptosis gene HAX1. Felty syndrome include all except A. Rheumatoid arthritis, B. Hepatomegaly, C. Splenomegaly, D. Neutropenia. Felty syndrome includes all except A. Rheumatoid arthritis, B. Hepatomegaly, C. Splenomegaly, D. Neutropenia. The correct answer here is hepatomegaly. So Felty syndrome includes rheumatoid arthritis, splenomegaly, neutropenia except hepatomegaly. Rheumatoid arthritis, splenomegaly, neutropenia. Rheumatoid arthritis, splenomegaly and neutropenia form the triad of Felty syndrome. Neutropenia is due to antibodies produced by the spleen that shorten the neutrophil lifespan, while large granular lymphocyte LGL can attack the marrow neutrophil precursors. Patients with Chidiac-Higashi syndrome may have which of the following? A. Seizures, B. Blindness, C. Nystagmus, D. Tremors. Patients with Chidiac-Higashi syndrome may have which of the following? A. Seizures, B. Blindness, C. Nystagmus, D. Tremors. So the correct answer here is A. Seizure. Patients with Chidiac-Higashi syndrome have nystagmus, partial oculocutaneous albinism, and an increased frequency of infections. Patients may develop a severe disabling peripheral neuropathy in adulthood. Vitamin C supplementation is useful in Chidiac-Higashi syndrome. Hematopoietic cell transplantation can cure the patients of Chidiac-Higashi syndrome. TAR syndrome means A. Thrombocytopenia with absent reticulocytes, B. Thrombocytopenia with absent renin, C. Thrombocytopenia with absent redi, D. Thrombocytopenia with abnormal vessels. So TAR syndrome means C. Thrombocytopenia with absent redi. TAR syndrome means thrombocytopenia with absent redi. congenital amegakaryocytic hypoplasia and thrombocytopenia with absent redi. Congenital amegakaryocytic hypoplasia and thrombocytopenia with absent redi produce a selective decrease in megakaryocyte production. Acute chest syndrome is due to which of the following? A. Transient coronary spasm. B. Transient intercostal muscle spasm. C. Sickling within the lungs. D. Pulmonary embolic shower. So acute chest syndrome is due to which of the following? Sickling within the lungs. C. Acute chest syndrome is a medical emergency and is due to in situ sickling within the lung, producing pain and temporary pulmonary dysfunction. It manifests by chest pain, tachypnea, that is fast breathing, fever, cough, and arterial oxygen desaturation. Repeated episodes of acute chest pain correlate with reduced survival. Disease due to mutation in tubulin receptor leading to selective defect in cobalamin absorption is A. Stickler syndrome, B. Imerslund-Grasbeck syndrome, C. Cogan syndrome, D. Menkes syndrome. The disease due to mutation in tubulin receptor leading to selective defect in cobalamin absorption is B. Imerslund-Grasbeck syndrome. Imerslund-Grasbeck syndrome is a congenital disorder, autosomal recessive, of selective defect in cobalamin absorption accompanied by non-specific proteinuria, but renal functions are normal. Mutation occurs in tubulin receptor that mediates intestinal absorption of cobalamin intrinsic factor complex. Patients have normal amounts of intrinsic factor and gastric acid, as are other tests of intestinal absorption are normal. Congenital pure red cell aplasia is known as A. Fanconi's anemia, B. Schwarzman-Diamond syndrome, C. Costman syndrome, D. Diamond-Blackfan anemia. Congenital pure red cell aplasia is known as A. Fanconi's anemia, B. Schwarzman-Diamond syndrome, C. Costman syndrome, D. Diamond-Blackfan anemia. The correct answer here is Diamond-Blackfan anemia. Diamond-Blackfan anemia or congenital pure red cell aplasia is diagnosed at birth or in early childhood and often responds to glucocorticoid treatment. A minority of patients have etiologic mutation in ribosomal RNA processing gene called as RPS19. So Diamond-Blackfan anemia or congenital pure red cell aplasia is diagnosed at birth or in early childhood, and it often responds to the glucocorticoid treatment. Macleod syndrome is related to which of the following blood group antigens? A. Lewis, B. Kidd, C. Kell, D. Duffy. It is KEL. Maculoid syndrome is due to absence of KEL precursor protein that leads to acanthocytosis, shortened RBC survival, and progressive form of muscular dystrophy that includes cardiac defects.